everybody. Okay, so today is my MRI. I get a full MRI of both breasts to see if the chemo treatment has lowered or lessened the tumors. It'll also capture under my underarm and just to see if the chemotherapy was working. So the results will be back in a couple days, and the results go to my oncologist and to my surgeon. And depends on what the MRI says is what the how the surgery will turn out. Now, the appointment for the surgery to discuss what we're going to do is next Wednesday. So today I'm doing the MRI, and I also have an appointment for the radiologist. Now, the radiologist comes in after surgery. So I'll have my last chemo treatment next week, which is Wednesday. So I'll have the appointment for the surgeon first. Then I'll have the appointment for the lab to get the catheter into the port so that they can distribute the infusion for chemo. Then I go to the oncologist and talk to my oncologist. Then after that, I get 4 hours of chemo treatment after that. So it's an all-day affair at the hospital. And so it's going to be a busy week next week, busy week this week. And we're rounding down. Now, next week is, yay, the last round of chemo until after surgery. So I am so looking forward to the 6-week break. My body needs it, obviously. Look at the dark circles under my eyes. My body's just super tired. I've been pushing myself to, exercise and just try to get healthy and strong again. So we're going to see. The sun is in my eyes. So we're going to see how far I can push myself. Mr. Christine is here, the chauffeur of the day, and so I'll try to film as much as I can, but it's definitely posted no filming in the MRI part, so I won't be able to do that. But we have an appointment with my radiologist. Now, I've never met the radiologist before. This is our first time going there. I've got my hairpiece on. It looks okay. So it's just I think it's going to be easier to manage doing the radiation part of it, because a lot of wigs have metal in it now, and this doesn't have any metal in it at all. So, and it's off of my face, because I think I'll be facing down, like face down, and then my two breasts go into like some type of holding cylinder or whatever. I've never had this part done yet, so we'll see. I don't know, but it's supposed to be able to show what's under the armpits too. Now my left side is the affected side. Now the right side has not been, like, I had a mammogram on it and it showed that it was clear, but that was almost a year ago. So well, not almost a year ago, it's about 6 months ago. So we don't know if the cancer spread or not, so that's another reason why we're doing the MRI, to make sure it hasn't spread to anywhere else. But the amount of chemo that I've been taking, there's no way that this thing has spread anywhere, because it's strong. I have been taking very, very strong chemo, super strong chemo. There's no way that any of that cancer has survived that chemo, because it about killed me. So we'll see what happens, but that's what's going on today, and I will see you all at the next step. Yeah, I'm here checked in at imaging, and then after that I'll check in at the radiation doctor. So, yep, I've already checked in. I'll call you when I'm finished. All right, bye. Just now, so they probably don't start until exactly 9. I'd say.
Should have a bunch of different kinds.
Wherever you like there on the right side.
All day then, Phil.
This reminds me of a hanky. It looks like a handkerchief material, like the design thing.
Hello, how are you? Looks like you've had a busy day today, is that right?
All right, yes. How are you?
Nice to meet you guys. And you have a little bit more time to go for your chemo, is that right? Next week?
Next week's
Is
my
your
last one. Yay!
Yeah, and then usually within a few weeks of there, we'd want to do the surgery.
Yes.
And we won't have any definite recommendations for radiation just yet. We need to get that surgery report.
Okay.
But I think we just wanted to touch base, put this on your radar
Yes.
so you know what to expect, things like that. We'll go from there.
Okay, and I do have questions. So, is radiation, will that make me as sick as the chemo?
No, I think you'll find it a lot easier than the chemo, okay?
Just the thought of having it next week is making me want to gag.
No,
It's horrible.
I think chemo, it's systemic therapy. It can, throw you for a loop. Radiation is very local therapy. We're only treating that area. Right now, I don't even have a radiation recommendation, right? No,
Right.
We're still trying to do lumpectomy, correct?
I talked with my family and everything, and I think since we've already went through all the chemo and all this stuff, I've came this far. I think I'm gonna choose a mastectomy instead, just because I don't want to have to do this over again. At all.
Yes. So I'm gonna leave some of that discussion to you, as these are two very different surgeries.
I think one you get radiation.
One you might not.
And
Yeah.
yeah.
But it depends. A lot of it comes down to what did we find at the time of surgery.
Yeah.
Okay. So there's some variables there we don't know. I think the first question for you is which type of surgery.
Yeah,
Okay.
he wants me to do lumpectomy, but
Yeah.
it's kind of my choice,
It is. You're the boss, right? But
and I
from
don't
a
have to do this again.
no, well, I wish I could tell you if you do the mastectomy, you won't have to do this again.
I know.
But what we'll do is go over a little bit of the data, okay? Why do
Yeah.
we pick lumpectomy versus not, okay?
Yeah.
And anyway, that's part of our discussion of radiation anyway, okay?
Right.
Whichever one you pick, we sort of want to go through that. But before we jump into that, previously, no other big health issues, no cancers, no radiation, and then you felt a lump,
Oh yeah.
and then ultimately we proved that it was cancer, almost
And
done
the
with,
lymph nodes too.
and almost done with chemo. Seems like it slowed you down a little bit.
A lot. Yeah.
And I think within a month or two from finishing chemo, all that will settle down. In that same time frame, you'll be getting surgery, so that will be another recovery, right? And then another month or so from from surgery, before things are really settling down for you. Okay.
So that's like so after surgery I get another healing process.
Yeah. If we were doing radiation, it'd be at least a month after surgery. Okay. And if we're not doing radiation, you don't have to worry about that.
Right.
But it's partly because of the scar itself, right? So after surgery, we want to make sure it has a chance to heal.
Okay.
Because if we were going to do radiation and we started too soon, it'd be slower for that to heal. And then also from a surgical perspective, nothing to do with radiation, we want to make sure there's no infection, bleeding. We want to make sure everything is settling down before we jump into any other treatment.
Okay.
Does that make sense?
So tell me what the symptoms, like the side effects are of radiation.
Let's go through all of that. Give me 1 second. I would just like to do a big picture discussion first. because I think that will also help you see where you are in terms of your treatment. And you know, the fact that, because if I remember, your genetic screening was good,
Negative.
right? Negative. And what we expect, most patients, if you had 100 patients with breast cancer, only 10 to 15 of them would have a genetic history, right? A gene mutation.
Yeah.
By far, most patients who have breast cancer, it's by chance, right? It's
Yes.
just you developed a cancer. It's not, unlike other cancers, right? We have smoking, sun exposure, drinking, you know, certain foods that are more linked to cancers. Breast cancer is just something by chance. It happened. It's not related to lifestyle or risk factor. It's not related to genetics. And you know, what do we do about it? Okay, so we'll go through some of that, and you know, we'll sort of go from there. Okay. Other than the lump, there was no other bone pain, fatigue, weight loss, anything else going into this, right?
No. And it was a shock to me to find out it was in the lymph nodes too, under my arm.
Mm-hmm.
I knew it was starting to swell, but I didn't feel any lumps or anything.
Yeah, and that's why I feel I don't want to promise that, hey, do your mastectomy and then we don't need radiation.
Right.
Does that make sense?
Yeah.
Because some of your disease characteristics, you might end up with radiation either way.
Because it's a triple negative.
Well, triple negative, but the lymph nodes too,
Okay.
right? Because if I remember, the size of the primary lesion was still relatively small. Is that right?
I don't know.
2 inches?
Yeah.
About 2 inches?
Yeah.
Is that about what you felt?
Yeah, I felt that. Yeah.
Maybe about this big? Thing is, whether you have lumpectomy or mastectomy, we might still end up recommending radiation. And so, medically speaking, what helps us pick mastectomy versus lumpectomy? So let's just go through a little bit about that before we jump into the details, okay? So breast cancer, right?
Yes.
Surgery. What's that? I know, I do. I was just looking for that. There's a little one here. Let me see if this one's any better.
And I think he mentioned afterwards getting at least 4 to 6 more chemos and maybe even a pill chemo too. Maybe. But
Yeah.
There's a lot of different plans.
A lot of options,
Yeah.
and it's sort of like getting from here to Cincinnati, right? There's 10 ways to do it, just depends what we're dealing with and things like that. So we don't want to push too hard. You know, there's certain things that we want to do, but if the side effects, if your blood counts, if there are different variables, that we might switch gears, right?
Yeah.
So anyway, in terms of curative treatment, okay, if we want to try to get rid of this, you have to have a surgery,
Yeah.
okay? And then there's 2 types of surgery, as you know, lumpectomy versus mastectomy.
Yeah.
And in your case, what we're doing is, look, it's decent size enough. Can we shrink it with the chemo first to make the surgery easier? Okay, whatever surgery you're having, the smaller the problem, the easier the surgery.
Yeah.
Does that make sense? Another goal of radiation is if by chance there is microscopic disease somewhere in your body, chemotherapy, hormone therapy, they're systemic, right? They go in by mouth or IV, they could work head to toe. So if there's some problem somewhere in your system, chemo can potentially help kill it off, right? Radiation, as you know, is a high-powered X-ray. You can't hear it, feel it, smell it, see it. Doesn't make you glow in the dark, okay? You don't have to avoid
How come I don't have to glow in the dark?
You don't have to avoid other people, kids, anything like that. But that, like surgery, is also a local therapy. It only works where we're pointing it, okay? And the role there is the same. If there's microscopic disease left behind, we want to try to kill it off with
Now you're saying where you're
radiation.
pointing it. Does that mean like injection,
No,
or
no,
is it just
it's a beam.
Like
Like,
a beam.
sort of
Okay.
like, it's very different than a beam of a flashlight, but similar, right? Like we can direct where it's going, okay? So what your doctors did a few months ago is, okay, what should we do? Number 1, let's try to shrink things with chemo, okay? Number 2, with chemo, if there's a problem somewhere else, you know, chemo is what can help us, you know, get it under control. And then we're about to do the surgery, okay? So even if you'd met me after surgery, I often review a little bit of this. And essentially, what is it between lumpectomy and mastectomy that helps us decide how to treat, okay? So if you think back 20 years ago, 30 years ago, 40 years ago, what was the most common type of surgery for breast cancer? It was mastectomy,
Yep.
right? And back then, we did not have mammograms, right? We didn't have the public awareness, and often, by the time you found a problem, it was very big,
Yeah.
okay? And mastectomy is a good surgery for that. And at that time, we really didn't have all the same chemo options, the hormone pill options, and things that we have nowadays. Okay,
Which that doesn't apply to me though, right? The
Th-
hormone.
this doesn't. Okay, but this does, right? Because the medicines you're on 40 years ago didn't exist.
And the X-ray wasn't as precise.
It wasn't as precise. The dosing was different. There was a lot of variables there. The radiation machines that we use nowadays, they were first invented in the 1950s, okay? But just like cars in the 1950s, cars now are a lot different than what used to be. Yes, we had cars, but they weren't as...
They didn't park themselves.
No, right. And same with radiation, the targeting, the monitoring, the dosing, all of that is a lot different than it used to be back then, okay? So anyway, so if the tumor typically was taken out mastectomy, eventually we started doing lumpectomies, okay? Because number one, we were finding them sooner. The public awareness was there that, hey, I feel a lump, I better go see what's going on. And we started doing lumpectomies, okay? And what we found in the early days of lumpectomy is that even when we thought we had it all, the cancer came back, and that's what we call recurrence, okay? So when we compare lumpectomy to mastectomy, lumpectomy had a higher rate of recurrence, and this is, so, you know, in those days, we said, look, we thought we had it all, we thought surgery with lumpectomy went well, but a year, 5 years, 10 years later, we had a problem, okay? So then the next question was, okay, what else can we do? We still don't want to do mastectomy because, number one, it's a big surgery, you're under anesthesia longer, you remove the whole breast, you're removing muscles, lymph nodes, you know, that's a big surgery.
Drain tubes.
Drain tubes are possible, and so what did we start doing? Okay.
Lumpectomies?
Huh?
Lumpectomy?
No, when we started doing that, we showed that, well, surgery went well, but we had higher recurrence.
Right.
Immune
Right.
therapy.
Immune therapy is brand new, right? That's pretty new.
Yeah.
So we said, okay, let's try something else. And the answer that we started was radiation, okay? So what we've shown over the course of multiple years, multiple thousands of patients treated, is that when we do lumpectomy plus radiation, we get equivalent recurrence risks as if we'd done a mastectomy, but the surgery is a lot easier, the cosmetic outcome is a lot better, the recovery is a lot faster. Okay, let's try something else. And the answer that we started was radiation, okay? So what we've shown over the course of multiple years, multiple thousands of patients treated, is that when we do lumpectomy plus radiation, we get equivalent recurrence risks as if we'd done a mastectomy, but the surgery is a lot easier, the cosmetic outcome is a lot better, the recovery is a lot faster. Okay, let's try something else. And the answer that we started was radiation, okay? So what we've shown over the course of multiple years, multiple thousands of patients treated, is that when we do lumpectomy plus radiation, we get equivalent recurrence risks as if we'd done a mastectomy, but the surgery is a lot easier, the cosmetic outcome is a lot better, the recovery is a lot faster. Does that make sense? So for most patients who are candidates for lumpectomy,
What would make you not a candidate?
if the tumor was too large, okay, and that's such that, say, the tumor occupied 80% of the breast, there's not going to be much left by the time we take away 80% of the breast,
Right.
right? So from a surgical perspective, from a cosmetic perspective, we might just say, let's just do the mastectomy, okay? So tumor size is one of them. Where the tumor is, if it's invading the chest wall, there's certain reasons, but part of why we do chemo up front is to make that surgery easier. Either surgery makes either surgery easier. And if it's feasible, like I'm saying in your case, you're young enough, there's enough questions about your initial tumor size, I'm probably going to end up recommending radiation anyway, whether or not you have mastectomy or lumpectomy, okay? I hate to promise that just yet because I really need to see the final path, right? The final findings of your surgery before we make final radiation recommendations. But it's probably not going to get you out of radiation.
Okay.
Does that make sense? And now you've gotten a bigger surgery, longer recovery, harder everything, and we're still doing radiation. Does that make sense?
Yeah.
And essentially, long and short of it is what we've shown is lumpectomy plus radiation has the same success rates as a mastectomy. Okay, in terms of recurrence, things like that. So in your situation, that's what I'm saying. The tumor was big enough, we were concerned enough about those lymph nodes that we saw them, we biopsied them, we know that they were there. All takes them out, we have to see, okay, what's left, okay? How many did we find? Is there disease still in them? Is it all dead? And it's say, even whatever we see on the scan, that's fine. We definitely want to get those out. But ultimately, the final decision is based on what we see under the
Like when it gets in
microscope,
there.
okay? So what, and say, for example, what they'll tell us is that we took 10 of them out and 5 of them had cancer. We took 20 of them out and 3 of them had cancer, right? So they'll take out what they can get, they'll look at it under a microscope, count them up, tell us how many had cancer, how many didn't. Does that make
that's
sense?
good. Yeah.
And that also plays into our radiation decision.
Okay.
Okay? So what I would caution you is, I
So
don't
you're
think
saying a lumpectomy with radiation is the same as
same
a
recurrence risk as a
mastectomy?
mastectomy.
Right.
Okay? And say in your case, you're probably going to end up either way, lumpectomy plus radiation or mastectomy plus radiation, because we still have the lymph node questions.
Right.
Right? And the size of the primary as it measured before chemo.
Yes.
Okay? And again, we're hoping after chemo everything shrunk down, gone, dead. You know, I presume you can feel that it's shrinking,
yeah.
right?
I can't even feel that in
Yeah.
the breast anymore.
So I think that's where I'm feeling just make an informed decision in terms of what's right for you, mastectomy plus versus lumpectomy. In patients who can have a lumpectomy, You know, that's really the most common approach we take nowadays.
Make it hard on yourself. It's the same. A lumpectomy is the same reoccurrence with radiation treatment as a mastectomy would be, and still get radiation treatment for reoccurrence.
Yeah, so the data we have is mastectomy versus lumpectomy plus radiation, okay?
Yep.
In your case, you're getting almost the whole 9 yards.
Yep.
Right? So then, do you look at this data, lumpectomy plus chemo plus radiation, mastectomy, well, in your case, chemo, then surgery, then radiation, right? You're getting a lot thrown at you because of your disease characteristics, the triple negative, the size, the lymph nodes.
Yeah.
Okay?
Yeah.
Body.
And we still want to cut it out, but what we're saying
You
is
just
that
gotta take less.
a lumpectomy might not be any better or worse than a mastectomy in terms of cancer recurrence, okay?
That's
Everyone-
my concern, the recurrence right there.
Well, but everyone would agree that, look, if this is the same, why are we putting you through a harder surgery, more anesthesia, longer recovery, the whole breast is gone, muscle is gone, right? It's a big surgery.
Yeah. Mentally too.
Mentally as well, and again, it doesn't preclude reconstruction, right? We can cross that bridge when we get there, but you know, whether you have lumpectomy or mastectomy, you might still be a candidate for reconstruction down the road, especially if the lumpectomy size was big, or if you had a mastectomy, things like that. But all those surgeries are harder with mastectomy versus lumpectomy, right? Because you have less tissue that you're dealing with to do the reconstruction.
Yeah.
Okay.
What's the drawback with taking lymph nodes? I mean, what's that do to you?
So lymph nodes, even if you didn't have them involved, we'd still want to sample some of them, okay? When they're involved, we want to get all of those out and check the neighbors. Is there any problem there? Is there any tiny disease? And the lymph nodes, head to toe, we have about 1,200, okay? And they are important in getting fluid back to circulation, right? So arteries take blood away, veins bring it back, and in the process, you lose a little bit of fluid, right? It leaks out. The lymph nodes collect that, get it back to your heart. So when those streams or those vessels are blocked up or removed, you can have chest wall swelling, arm swelling, hand swelling. That can also be painful and tender and impact. This is your left side. Are you right-handed?
Right-handed.
So, but even say, for example, putting buttons on, doing things with your left hand, if your fingers are twice the size that they used to be, it's a problem, right? And all of that is more challenging the more lymph nodes we have to take out, okay? So it's not that you're gonna have an easy, hey, I'm gonna do this surgery, everything's gonna be back to normal. Even if you do a lumpectomy, the fact that you had lymph nodes involved is not in your favor.
Yeah.
Okay? Is not in your favor.
Yeah.
Okay? So anyway, keep that in mind when you talk to him. Make a decision that you're comfortable with, okay? But medically speaking, there are situations where he would recommend mastectomy. There are situations that he'd say, I think I can do a mastectomy. Yeah, and it's based on the fact that we have decades of data showing that doing that mastectomy up front doesn't impact our recurrence risk.
Okay.
Does that make sense? And whether you have lumpectomy or mastectomy, you still have a relatively similar risk of recurrence. As long as we're alive, it's not zero, right?
Right.
You know, you can get hit by a tree, you can get hit by lightning, you can have breast cancer come back, right? So those numbers are similar between the two after you've had these treatments. Okay? And those are single digits. It's not 30%, it's not 50%, it's single digits, but it's not zero. Okay? So those numbers are similar between the two after you've had these treatments. Okay? And those are single digits. It's not 30%, it's not 50%, it's single digits, but it's not zero.
Hey everybody. Okay, so we are finished with the appointment today from the hospital. I have already did the MRI, and oh my gosh, the MRI, they lay you flat down on your stomach and your boobs are like dangling in this like pockets, and your head is like kind of submerged, like going to like a massage chair kind of thing, and you have to lay there so still for like a half an hour. That was hard. Oh my gosh, it was so hard. So then after that we went ahead and then I went to the appointment for the radiologist, and he was really informative, and he explained to me the difference, why they would recommend a mastectomy or a lumpectomy over a mastectomy, because nowadays the treatments have become more advanced, and back in the old days when you had triple negative breast cancer, their solution was to do the mastectomy. But because my genealogy, my genes came out negative for cancer, and doing the radiation treatment, it is the same percentage as doing the mastectomy, if, you know, as far as reoccurrence of cancer. So doing a lumpectomy, lumpectomy and radiation is the same equivalent as to doing mastectomy, meaning the whole breast gone, and radiation. So it's the same. This, as the percentage in recurrence is the same. So he explained that to us. We will be talking to the surgeon next week. So the schedule is Monday I go for my echogram because the red devil does something to the heart, damages the heart. So I do that at 7 o'clock in the morning. That means I got to leave my house by 6. That means I got to get up and get ready before that and fiddle with grandma and get her all fed and changed and all that. Ooh, that's going to be a hard one. And my son's going to go with me on that one so that my husband can stay home with grandma. And then on Wednesday, I've got the appointment with my surgeon. And then after that, I will have my chemo infusions, and that's the last one of the Red Devil. Yay! So excited. And then, so that's the schedule. So we'll see, but this is the end of the day, and we are going to go and check the P.O. box, and then we're going to grab some lunch and go home. So I love you all so much. Thank you all for all the love, all the support, all the prayers, all the encouragement, and I'll see you on the next video. Bye.